Hello. Hello, everyone. Happy Thursday. It's Thursday. Yay. One more day until the glorious weekend that most of us live for. Who is out there? Hello, everyone. If you happen to be out there in live land and you want to come play with me and say hi and learn with me, now is the time. I'm going to wait a few seconds to see who comes into the room, who joins our session, because I think that this is going to be educational for someone. And if it's not for you specifically, it may bless your family and your friends. Hey, Dr. Dre. Hi. Who else is there? Hey, Dr. Shelley. Yes. Hey, Patrick. Welcome to my show. It's 7:30, and I hope this is running through. It's 7:30. I am Dr. Teresa Wright. I am a board certified medical doctor. I am also a certified health coach, and I am here because I help high performing professionals through my books, speaking, and other engagements to learn how to love themselves better. And so I just wanted to come on and give you all some tips, 4 tips specifically for speaking with your doctor. So say hi to me. Let's make this interactive. Ask me any questions you want. Hopefully you all are seeing me fine. I feel like I'm getting some. Oh, good. Hello, Dr. Mildred. I thought I was having some connection issues. I don't usually have connectivity issues, but I got the sense that I was. Hello. So I don't know what that was about. That's new. I usually go live every Thursday here at 7:30. And so tell your friends, pass the word along. I'll wait a few more seconds and then I'll tell you all 4 tips for talking to your doctor. In the meantime, if you have questions about what I'm saying, ask below because I want to be able to communicate with you all and educate. And again, as I said, I am Dr. Teresa Wright. I'm a board certified family medicine physician. I'm also a certified health coach. I help high performers like yourself get healthy and well through my books, speaking engagements, and writing. So let me know what you think. So the first thing is, if you're going to go to your doctor or if you're going to communicate with your doctor or speak with your doctor, I would like you to know your medicines. Please know your medications. Because it's really hard to have a conversation with someone when you don't know the medications. And don't get me wrong, I know the names are really complicated. So if you're having a hard time communicating the name of your medications, I would suggest that you bring your bottles. And if you have another doctor that's prescribed you something, you bring it to your appointment so that every single doctor is on the same page. What's really difficult is getting a message from someone or having someone come into the office and they say, that medicine you gave me caused me to have a rash. Or I had a bad side effect from a medicine that I was given by another doctor, but they're not able to tell you what that medicine is. That is very, very worrisome because we don't know what created the issue, and so it's really hard to treat when we're not sure what's going on. Another thing is, sometimes you come in and you said that medicine that was prescribed didn't work. And my question usually is, hey Chastity, what medicine was it? When was it prescribed? Well, a few months ago you prescribed something for my back or for my belly and it didn't work. That is not very helpful to me to be able to help you. What's more helpful is if you brought your medicines in, and so we could actually talk about this bottle with these pills did not do what you said they were going to do. If they were for your tummy or your belly, well, I had belly pains, Dr. Wright. You gave me this medicine. It did not help my stomach. That's very helpful for me because then I could go ahead and switch that out, change the dose, any of those things. But if I don't know what you're talking about, if I've prescribed you 10 pills in the past 10 months, it's really hard for me to know what we're doing and how to do an intervention. And so it may take me a while to figure out what we could do to help you or treat you appropriately. In the meantime, I may prescribe multiple other medicines trying to sort it all out. And so that's more money out of your pocket while we figure out what the communication barrier is. So just a thought. Another thing to really think about is some folks come in and they say, the purple pill did not help me, or the purple pill made me sick, or the purple pill was not very beneficial. Hey, Dr. Kyron. And the problem with telling me the color of your pill and not the name of your pill or the information that I need to identify the pill is that the pill colors change. It really depends on who your manufacturer is and what they had, what they put in the pill that month, and if you're getting it from a consistent supplier. All those things affect the color of the pill. If it's a brand or a generic, all those things affect the color of the pill. Hey, who's there? And so it's really hard for us to know what you're trying to communicate to us if we don't know. So I say this is my rule for my patients. If you can tell me the name of your pills, then we can communicate effectively. If you cannot name your pills, then you have to bring your pills in. If you don't bring your pills in and you want to communicate with me about your pills, you have to go home, get your pill bottles, and call me with that information or bring it back. Because I'm trying to save your life, or I'm trying to fix an issue that you're communicating with me. I'm trying to treat something. It's really hard to do that any other way. Hello. And so that's the first tip. Know your medicines, and if you don't know them, have your bottles or have a med list, have something. And always tell every doctor if someone else puts you on something. So my next tip is to define the problem. Here's what happens sometimes. I have folks come in and they say, I don't feel good and I don't know what's wrong. Tell me what's wrong. That is so very non-specific. I am a master puzzle. I could put a puzzle together really well if I have all the pieces. If I don't have all the pieces, I have an incomplete puzzle. So the more information you give me, the more likely I am to connect all the dots and make that puzzle work for you. Now, in all fairness, sometimes you really don't know what's wrong. You really don't know where it's coming from, if you're having pain or if you feel something and you just can't define it. I do understand that. And some things evolve. So it might start out just feeling like, I just don't feel good. And that's okay to tell your doctor that. But understand that your doctor might say, well, we might need some time to figure this out. We may need to get some blood work. We may need to get some testing. They may ask you to keep a journal of your feelings and what you're eating. They may ask you to come back in 2 weeks because they're hoping that whatever that is will evolve into something. So what I like to ask folks is, I usually say to them, give me one finger and point to where it feels like it's starting. And that might point here, it starts here, doctor. It starts right here. And then I said, well, tell me where it's going. Well, it goes this way. It goes right this way. It starts here and it goes here. That already gives me more information than you just saying, my shoulder hurts. I don't know anything about it. Just tell me what's wrong. You will do more for yourself and your doctor and your health with the more information you provide and as specific as you can be. So when you're communicating with your doctor, just ask yourself, if I could point to one place that feels that it's all where everything's kind of starting, where would that place be? And if I could tell the doctor where that is going, where that sensation, that feeling, that general unwellness seems to be traveling, that also gives information. And then expect questions. Don't get annoyed or upset if your doctor asks you follow-up questions. Again, we are putting pieces of a puzzle together. We're really good at that. But every piece matters, and if there's a piece missing, it really does affect how fast we're going to find the answer for you, how many tests we have to do to find the answer, and the cost that you're going to spend to find the answer a lot of times. And then sometimes you may go to the ER and they find the answer like this. Well, that's because they have access to a lot more testing in a shorter period of time. And by the time you get sick enough to go to the ER, you know exactly, you're like, yeah, it's right here. It's right here. Like the pain or the issues are that bad that you're actually going to the ER. And so they actually get a lot more information than we get in the clinic. And they have a lot more access to resources to do things really rapidly in the emergency room than they do in the clinic. So define the problem as best you can. Tell your doctor what's going on as best you can. Be as specific as you can. My next tip is to spend your time wisely. Now, I don't know if you noticed, but your doctor always seems to be heading in and out of the room. Soon as they sit down and they're getting ready to talk, it's almost like they're heading out again. That is because you literally have a 15 or 20 minute spot with the doctor. That's your allotted time. Now, if there's a long checking in process, you're checking in, getting your vital signs taken, talking to the nurse and all that, that may cut into your 15-minute slot with the doctor. If there is something else going on in the office, that may affect your time with the doctor. What you don't want to do is get into your clinic appointment with the doctor and spend 20 minutes telling the doctor how bad they are at being a doctor, or telling them all the things that you hate about the office, and then expect to spend another 20 minutes telling them how you feel and what's going on. Because the likelihood that you're going to get all your concerns that are medical out are going to be really, really affected by how much time you spend catching up, showing pictures of your children, which is all great. We love that. We want to, as family doctors specifically and primary care doctors, I want to know all about your family. But I want you to tell me about your chest pain when I get in the room. I don't want to hear about it when I'm saying, okay, Miss Johnson, your visit is over. Have a blessed day. And then you're like, wait, doc, I didn't tell you about my chest pain. We literally just spent 20 minutes talking about everything but the most important thing in the room. So we want to always be sure that we're spending our time wisely. I can't tell you how many times I've gone into a room and spent 20 minutes doing the pleasantries and listening to the heart and the lungs, and then I get ready to leave. Like, my hand is actually on the door and I'm getting ready to leave, and they say, wait, I fell last week and I broke this hand. And I'm like, we probably should have started with that. Like, that probably should have been what we should have been talking about this whole visit. And again, it's not that we don't want to spend the time getting to know you, but we also want to do right by you with your medical concerns. So we would rather address the medical concerns if they're really pressing and they're really on your heart or on your mind, or you're losing sleep over them. And then what time is left, we would love to talk more and get to know more about what's going on with the family and friends and things like that. But what you don't want to do is wait until the visit is over to bring up something that's really been on your heart for like weeks, especially if you go to a doctor that you only see a few times a year. You really want to get them caught up on what's been going on with you. I've been in the emergency room, I was in the hospital, I had my appendix taken out. You want to get them caught up on all those things. I found out that I'm allergic to this and that medicine, and you want to get those things caught up. What about my pap? What about my mammogram? I need to get my prostate checked. You want to address those things first, and then you want to spend whatever time is left doing all the other things. So I hope that was helpful. Now, lastly, you want to follow up. If you come into the office and you tell your doctor that you're having back pain and they do an intervention, let's say they prescribe medicines, or they give you a shot of some kind, a pain shot, or they get x-rays, or they send you to physical therapy, and they say, well, follow up with me in 1 month, or follow up with me in 2 weeks, or whatever your follow-up is, you want to go ahead and follow up. You don't want to, here's what you don't want to do. You don't want to take the medicines for 2 days, realize it's not helping, throw it in the trash, and then wait 6 months to tell your doctor that that didn't help. Especially if the issue is ongoing and now you've got complications. Because that's a long time to wait to tell someone that something that they thought they did that was helpful was not very helpful at all. And it can actually be very scary if what they're treating evolves into something else and they're not even on board for that. So I want you to follow up. Now, if an intervention was done and your doctor says follow up in 1 month, but it's 2, 4, 5, 6, 10 days later and you aren't getting any benefit from the intervention, hey Sarah, you want to go ahead and follow up sooner. You may want to just call your doctor and say, hey, I know you prescribed these medicines, but they're not working. I am actually feeling worse. And I'll give you an example. I have someone with back pain, and I gave a shot in the office. I prescribed medicines for the pain. I, ordered an x-ray. I did everything that I needed to do in that moment, given the information I had, to try to help the situation. The pain was going on the leg, started in the back, going down the leg. Because I asked, tell me where it starts and where is it going. And so I said, follow up in 2 weeks. Now, I see families. So one of the patient's families came in and she said, oh, yeah, that did not work. Things have gotten worse. Now we're wheeling around in a wheelchair and we're using a cane. That did not work, and now our family member's not walking that good. I literally said, where are they? Bring them in now. This is something that I need to know about. And we were able to get them in that same day, try another intervention, do some other things. Pain was much better, and they're wheeling and walking around much better. Now, if that person had waited 2 weeks, they would have lost 2 weeks of mobility, 2 weeks of strength, 2 weeks of their independence, because they didn't want to hurt my feelings. They didn't want to tell me that what I tried didn't work, and they really didn't think that they could. They didn't think they could come in outside of their appointment time to discuss their issues with me. I'm going to tell you that most doctors who do an intervention, they want to know if it didn't work. We like to believe that we are fixing things, and if we find out that someone's gone weeks and months without an intervention working, it actually makes us feel pretty unhelpful. And most doctors want to be helpful. We went into medicine to be helpful, and if we're not helping you, we want to know about it. Sooner the better. Now, to be fair, some things do take time, like a cold or the flu or a cough. But still, a follow-up is still better than not a follow-up and then finding out that you've got complications. So when in doubt, you call the on-call doctor, you call the triage nurse, you show up in the office for a walk-in visit, you do what you have to do to get your health in check. I talk a lot, but I hope it was very helpful. I hope it was very beneficial. If it applies to you, use it. If it doesn't apply to you, but you know you have friends and family who you know could benefit, share it. Sharing is caring, I always say. Thank you all for listening. I hope the connectivity wasn't too bad. I'm getting an indication that it hasn't been the best network connection, so I apologize for that. I am Dr. Teresa Wright. I am a board-certified family medicine doctor. I am also your certified health coach. I help high-performing professionals get it together. So let's do this, you guys. Let's transform our lives. Let's learn how to communicate. Let's do what we have to do to get healthy, get well, and stay fit. I love you all. Be blessed. Bye-bye.